Welcome back to Tune Up Tuesday. My name is Joe Gambino, and today we're going to cover the hip 90-90 and its importance for hip mobility. I often prescribe these for people who have really bad hip mobility, especially at the hip capsule. So those people who have difficulty with hip internal rotation and hip external rotation to allow for improved motion at the joint capsule, which will help overall improvement of hip mobility. This is very beneficial for those with low back pain because people who have limited hip mobility will often have altered lumbar spine mechanics, and that will cause pain over time just from overuse and the use of different movement patterns throughout actual exercises and living life. So the way we're going to do this is we're going to set up in the 90-90 position, which is a pretty common drill, but we're going to do it in a very specific fashion that we used with the functional range conditioning principles. So when we set up in here to make sure that our 90-90 is set up, we're going to take a poke at the front hip bone here, and we're going to draw a straight line out. That should set us up with the outside part of our knee, and then if I was to draw a straight line from the middle of my knee straight out this way, I should run into the ankle bone over here. Then my back leg should be a mirror image of this. My front lower leg here and my back upper thigh should be parallel to each other, and then my front upper thigh and my back lower leg should be parallel to each other. And if you have this, you know you're set up in the 90-90. The next step is to bow our stretch, or meaning that we're going to move parts of our body that's going to intensify the stretch in a certain area, so we don't have to make this big motion to just feel a stretch. So in order to do that, we're going to extend our spine as much as possible, and then we're going to take our belly button and imagine a string is pulling it forward. If you do that correctly, you're going to feel a nice stretch on the outside of your front hip, and it should feel like almost something wants to twist, okay? You'd feel a difference if you were to just lean forward. You're going to feel more of like a glute stretch, and you'll probably feel like it's a little more on the superficial layers or the more like outer layers, and then when you bow it and come forward, you're going to feel like the stretch is much deeper. And that's how you'll know you're kind of locked into that stretch. We're going to do PAILs and rails. PAILs stands for progressive angular isometric loading, which simply means that we're just contracting the stuff that's being stretched. So we're going to start by pushing very gently into the floor because we don't want to just push as hard as possible in the get-go. And then from there, just think about pushing down 25% of whatever your max would be. It's going to be the shin, the foot, and the knee all pushing down together, and then you're going to ramp that contraction up to 50%. Ramping it up to 75%, and then keep pushing harder until you're at 100% or whatever the hardest that you can possibly push without pain. You're going to hold that contraction for 10 seconds, and then we're going to move on to the rails contractions, which will strengthen all of the stuff on the regressive side of the joint, or the stuff that's being shortened. And in order to do that, we're going to use our abs to pull ourselves forward. We're not just going to let gravity take us. And at the same time, when I can no longer really take up any more motion, I'm going to try to lift my leg at the same time. It's not going to come off the floor. It's just going to add muscular contraction to all of this tissue to allow us to get pure 100% contraction of all of these tissues to help strengthen at this point in the range. After 10 seconds of holding this, you'll just rest, relax, and just stay here for a prolonged stretch of upwards to 1 or 2 minutes. When you're done with the front side, you'll go to the back leg for internal rotation. So you're going to grab on here. This is my right leg in the back, so my right hand's going to grab the ankle and my left hand's going to grab the hip. I'm going to twist myself so as if my sternum was trying to touch my foot. As I twist in here, I'm going to feel my stretch is coming right in my groin here, and again, it's going to feel like something's very deep and twisty. Once you're set up into your stretch, the PAILs contraction is the exact same thing as the front side. The knee, the shin bone, and the foot are all going to try to push into the ground. You're going to start with that same 25% contraction, ramping up to 50, pushing a little bit harder until you get to 75%. Keep pushing until you get to 100%. Holding this contraction for 10 full seconds. And then when that 10 full seconds is up, we're doing that rails contraction, which is now going to be taking these muscles here, reaching and twisting, trying to use my obliques to pull myself towards my foot. And when I can't get any further, I'm now trying to lift the leg off the ground to add more muscle contraction to the leg. Holding this for 10, then you're going to freeze in your new spot and hold this stretch for upwards to a minute or two. And then you switch to the other side and do both of those. Give this drill a try, see how it affects your hip mobility and your low back pain. I'll see you guys next Tuesday.